You either love your nose or you hate it. This is a common phrase that I'm sure we've all heard. Now, if you're someone that doesn't absolutely love their nose, but you're disinclined to have surgery, then this video might just be for you. Hi guys, my name is Dr. Haroon. I am a cosmetic doctor who specializes in non-surgical aesthetic treatments. In today's video, we'll be talking all about non-surgical rhinoplasty, commonly known as the liquid nose job. This is a procedure that has become one of the most popular treatments in the cosmetics industry. However, there are still some people out there that might not know that it exists or don't quite understand how it works. By the end of this video, you'll have a clear understanding of how a non-surgical rhinoplasty works and whether it might just be the right treatment for you. Let's get into it. You've likely seen stunning before and after results of non-surgical rhinoplasties that have left you asking the question, how is that even possible? A non-surgical rhinoplasty is a procedure that aims to enhance or augment the shape and appearance of the nose, using a thick gel made up of hyaluronic acid. This is a naturally occurring substance in the body. This gel is injected using a tiny needle into certain areas of the nose to make it look straighter, sharper, and more beautiful. It's important to mention that we are not volumizing the nose. The goal is not to make it bigger, it's simply to give it a more beautiful appearance, and if it's done well, it will actually make the nose look smaller. This procedure is one of the most artistic procedures a cosmetic doctor will carry out, and it's important that you choose someone who's experienced and has a proven track history. Probably the most important question when discussing a non-surgical rhinoplasty is whether you are a suitable candidate for this procedure. This all comes down to the original nose shape and what your desired outcome is. Let's look at a few types of noses that are suitable candidates and likely to get a good result from this procedure. A small bump on the bridge of the nose, known as a dorsal hump. This can be camouflaged and concealed by placing small amounts of dermal filler before it and after it to mask the appearance of the bump. A hook nose or a rounded nose. Placing dermal filler at the top of the nose and in the tip of the nose leads to a straighter looking nose from the profile view. A droopy tip or a downward pointing nose. Dermal filler can be carefully placed in the tip of the nose to lift the tip of the nose. A flattened nasal bridge. Dermal filler can be used to build up the nasal bridge to give it more structure. This is a common request amongst Asian or Oriental clients. If you have one or more of these features, you are likely to obtain a good cosmetic result from this procedure. However, if you have a large dorsal hump or a severely deviated septum from the front, this procedure may yield suboptimal results and surgical options may be the best. What to expect on the day of your non-surgical rhinoplasty? On the day of your procedure, the practitioner will have a detailed consultation with you and also carry out a thorough assessment to ensure you are a suitable candidate for this procedure. If you're deemed a suitable candidate, medical photos will be taken and numbing cream will be applied to the nose. After the nose is cleaned, a tiny needle will be used to deliver the hyaluronic acid based gel. It's hard to say how many injections will be needed, but it usually ranges from 6 to 12 injections for this procedure. Tiny amounts of dermal filler will be added per injection until the ideal nose shape has been achieved. After the procedure, there will be some redness and some swelling. For most people, this is minimal and you can see a noticeable improvement on the day. The swelling will usually get slightly worse in the first 24 hours and then start to settle after that. The final result is always at the 2-week mark, once all the swelling has gone down and the filler has integrated. This result should last for around 9 to 12 months, depending on how quickly your body breaks down the filler. That was it, guys. That was the ins and outs of a non-surgical rhinoplasty procedure. I hope you found this video helpful, and if you have any questions regarding this treatment or any other treatments that we offer, please get into touch. Thanks a lot, guys. Bye now.